Hypothermia is a dangerous condition. This occurs when your body loses heat faster than it can produce it, resulting in a body temperature less than 95 degrees Fahrenheit. Generally, heat is lost from the skin's surface through the process of conduction, convection, evaporation, and radiation. Understanding hypothermia is crucial, as it can quickly become life-threatening. Imagine the body as a furnace, constantly generating heat. When exposed to extreme cold, this balance is disrupted. The body struggles to keep up, and the internal temperature starts to fall. This is when hypothermia sets in, posing a serious risk to the patient. There are two categories of which hypothermia is classified: primary and secondary. Primary hypothermia is a result of environmental exposure, while secondary hypothermia is a result of underlying disease. Regardless of which type a patient may have, untreated hypothermia may lead to cardiac arrest. Our bodies are remarkably resilient, equipped with mechanisms to combat cold. When exposed to cold, vasoconstriction narrows blood vessels to reduce heat loss. Shivering generates heat to raise the body temperature. As core temperature drops, these responses become less effective. Exposure to cold weather is the most common cause of hypothermia. This can occur from being outdoors in cold temperatures for extended periods without adequate clothing or shelter. Water conducts heat away from the body much faster than air, making hypothermia a serious risk for anyone who falls into cold water, even for short periods. While anyone can develop hypothermia, certain individuals are more vulnerable. Infants and young children have a larger surface area to volume ratio, making them susceptible to losing heat more quickly. Older adults are also at increased risk. As we age, our bodies become less efficient at regulating temperature, and patients may present with a diminished shivering response. Patients who also are engaging in risky behavioral choices, particularly excessive alcohol and drug use, can significantly be at increased risk for developing primary hypothermia. Excessive consumption often impairs judgment, decreases awareness and sensation of colder temperatures, and interfere with the body's natural shivering response. Patients under the influence of drugs and alcohol may fall asleep or overdose in an environment that leads them to being exposed to the cold for prolonged periods of time. As hypothermia progresses, the patient's internal systems begin to shut down. The heart rate slows, leading to bradycardia, the respiratory rate will become more shallow, and mental function deteriorates due to the lack of oxygen being circulated throughout the body. The patient may become or present with disorientation, confusion, and even be unresponsive. A late warning sign of severe hypothermia is the cessation of shivering. While it may appear as an improvement, it's actually a sign that physiological regulation of homeostasis is failing. Patients with moderate to severe hypothermia may express that they feel hot and even try to remove their clothing. This is known as paradoxical undressing and is associated with an increased rate of mortality. It has been suggested that this response can be attributed to a malfunction of the hypothalamus, the part of the brain that regulates body temperature. All patients with suspected primary hypothermia should have a head-to-toe assessment performed to identify any additional injuries sustained from exposure to the cold. Remove any and all cold and wet clothing items and dry the patient's skin with cloth towels. Cover the patient with warmed, dry clothing. A nurse should anticipate performing the following immediate interventions. Obtaining vital signs. Temperature will be obtained by the rectal, urinary, or esophageal route for best accuracy. Assessing pulse oximetry values and anticipating supplemental oxygen orders from the physician. Initiating cardiac monitoring. Large bore IV access should be started in 2 different sites to prepare for rewarming or resuscitation efforts. Initiating gradual rewarming efforts. Examples of this may include the use of heated blankets, warmed intravenous fluids, or external temperature management devices in extreme cases, such as a bear hugger. Vital signs should be recorded every 15 minutes until normal values have been achieved, unless directed otherwise by the ordering physician. Thank you for watching this video. Remember to follow us, like, learn, subscribe.